Okay, can you see the screen now? Okay, so let's get started. I'm very excited to be with you today discussing about the road of to the UK from the ophthalmology exams. So this lecture will be an orientation
لا
lecture.
خلص ودي لها واشربي معي.
I think that everyone should be muted. Please mute your mic if okay. So this lecture will be about the road of the road to the UK ophthalmology exams and how to pursue your career in the UK in the sense of being registered in the General Medical Council and being able to start your career. Today's lecture will be in the 4 points or the 4 topics that will be the content of our lecture. The first of all, we will discuss the UK ophthalmology exams and know what are the different postgraduate ophthalmology qualifications in the UK and how to gain access and how to dig your route through these exams. The second of all is how to choose the best pathway. So if you know what are the different post-ophthalmology qualifications, then how to start or how to choose the best pathway that will be suitable for you specifically, not for anyone else. The third thing or the third topic will be what are the best study resources. So I usually update the study resources on regular basis because changes are happening very quickly. So we need to keep up with the pace of these changes in order to attain the highest marks in the exam. And finally, what are our courses and what are the special offers that can we offer to you in order to help you to pass these exams. So first of all, many of you maybe may not heard about me, so I will just tell you more about myself. My name is Ahmed Hamdi, and I have been teaching with a postgraduate ophthalmology for like about 7 years, but my teaching experience is extending further than that for like about 10 years. Starting with the International Council of Ophthalmology Exams. Let's first start with the ICO exams being the most popular. So what are the advantages and disadvantages of ICO exam? What makes you choose or think of ICO as a suitable postgraduate qualification in ophthalmology? There will be some advantages. For example, that they are the easiest exams already. So even though that the last exam wasn't that easy, however, all in all, generally speaking, the ICO will be the easiest exams. You can attend, or you can start these exams even in the internship as your house officer, because they don't require any experience. You just present your medical postgraduate medical qualification, and you can immediately start with the visual sciences or basic sciences and optics. The nice thing also about the ICO exam that you have regular examination dates, meaning that they can be done twice yearly in April and in October. So whenever you are missing a date, you can follow the next date. Also, if you have ICO exams or you have passed the ICO exams, you have a privilege to apply for ICO fellowships. So those ICO fellowships are some training programs that can extend from 3 months to 1 year, and these are offered to young ophthalmologists from developing countries in order to have some training in developed countries or a higher center for ophthalmology training. This can be abroad, and those who have passed the ICO exams, they receive some special treatment or some special privilege. Also, one of the advantages of the International Council of Ophthalmology exams is that there are many available question banks. The question banks are recall exams that are available, so you get the sense of how do the exam look like, and you are training on these questions banks so that there are a lot of repetition from these questions banks. And also the advantages about the ICO exam that they are available worldwide. So ICO examination centers are spread all over the world. You just log into the ICO website and check for your country and try to or click on find center, and you will be probably find your country is one of the countries listed for the ICO exam center. So it's called international for a reason, that it is very, very international and very, very widely distributed among the whole world. However, there is nothing without disadvantages. There are some disadvantages associated with the ICO exams. First of all, or the last advantage is that the fees are relatively low for developing countries. This one, I can consider this one of the confusing points about the ICO. The ICO doesn't have a fixed pricing policy among all the countries. They give some discounted fees. Apart from those are published on the website, there are some discounted fees for coordinators or group registration through the coordinator, and also there are some discounted fees for candidates from developing countries. So these are maybe considered as an advantage for the ICO exams. However, if we are comparing these the exam prices, the official prices in the website, to other exams like the FRCS Glasgow, we will find that the ICO exams are much higher. But if you book through a group registration or coordinator registration, or you are from developing country, the prices will be far less. So what are the disadvantages? Recently, from like about 2 years, from like about 1 year, the ICO doesn't grant GMC registration alone. Meaning that the ICO, when the ICO first arrived on the surface, it has never given GMC registration, meaning that it was just a theoretical exam of paper, ICO first part, second part, third part. So you don't get any GMC registration. It is just a certificate. However, after recent collaboration between the ICO and the Royal College of Surgeons of Edinburgh, the ICO exams were considered to be making the candidates eligible to apply for GMC registration. However, this regulation changed lately, meaning that the ICO alone now cannot be considered as an end exam. So it can be considered like a shortcut to apply for GMC registration. It can be shortcut for other exams like FRCS Glasgow or FRCS Edinburgh. But alone, it is not enough to have or to be registered in the GMC. The second thing about the ICO, if we want to call the ICO a name, then it will be the inconsistency. The ICO is always inconsistent in their results, meaning that there are some exams are easy, some exams are very, very tough, and you cannot have you can't predict how the ICO are thinking and how will they bring an exam. Like, for example, the last exam was really, really tough, although the previous one in the July was very, very easy and very repetitive. So inconsistent results are one of the drawbacks of the ICO, and also the inconsistent regulations. The ICO always changes their regulation. Let me say to you that the constant fact about the ICO that they always change their regulation. So they make some sort of collaboration, and then they break this collaboration, and even their regulations are not well announced in their website. They show lag in the announcement of these regulations. So if you are planning, or if you have long-term plans, you can't rely on the ICO alone. This can be the exam leaks and recalls can be an advantage or a disadvantage. Can be, of course, an advantage for those who have these leaks and recalls, and of course it will be a huge drawback for those who don't have these leaks and recalls. So again, this is one of the package of inconsistency of the ICO exams. So being a professional exam won't allow exam leaks or presence of these recalls, as for example the FRCOPHTH London. There is no single or there is no questions about leaked from the FRCOPHTH London exam. As I told you, lack of website updates. You may to give you an idea about this lack of updates. Till now, the ICO website doesn't have any curriculum, any updated curriculum for the visual sciences and optics and the clinical course. So how could that be possible? If you are a candidate who are sitting for the exam, you don't know what are the topics that you will be examined in. These were present in the previous period, like before the collaboration, but in the recent period, the updates in the website, like what are the duration or what are the timing of the exam, when will be the next exam, these are they are announced very, very late at ICO website. Okay, so after we have gone through the ICO advantages and disadvantages. Let's see what are the ICO exams. The first exam of the ICO is called the Visual Sciences. And the Visual Sciences, there is no experience required for that exam, which is an advantage. This exam consists of 120 questions or 120 MCQs. The pattern is a single best answer of 4 choices. And this exam is done in 3 hours. So what is the syllabus or what is the curriculum for the exam? This is based on the previous exam, and these numbers are not fixed, but they are an estimate. So usually the anatomy comes in 25 questions, embryology in 5 questions, neuroanatomy in 15 questions. So you can see that the main bulk of the exam is the anatomy. Anatomy is very, very important in ICO and FRCS and any postgraduate basic exam. Then the second will be the vision, physiology, biochemistry, and cell biology, and this will make up to 20 questions in the exam. Then the pharmacology, making up to 15 questions in the exam. Pathology, it's also 15 questions, but to be honest with you, they are saying it is only pathology, but it is pathology and immunology. Microbiology is 10 questions, and genetics are 10 questions. And finally, the least part will be the epidemiology and the statistics, making only as low as 5 questions. So this is the syllabus. or the curriculum of the visual sciences, and which was previously termed basic sciences in the exam in the ICO, or sometimes it is called Part A. This is usually the ICO recommended that you set the visual science together with the second part, or the optics, refraction, and instruments part, or Part B. This exam can be set in the same day with the visual sciences or can be taken separately. Again, this exam doesn't require any experience. They consist of 60 MCQs, single best answer of 4 choices in 1.5 hours. The syllabus is optics, so this will be discussed 30 questions in optics, in the physical optics, in geometric optics, and laser and others, and 20 questions in refraction, so covering the clinical refraction and retinoscopy, and finally 10 questions in the instruments. So this is the average of distribution of marks and the questions within the optics and the refraction test of the ICO exam. The clinical ophthalmology, this is called Part C, and this again, this part doesn't require any experience, and you have 200 MCQs. This one of the long exams. It consists of a single best answer questions of 4 choices that to be solved within 4 hours. What is the syllabus of this exam? It will be almost all chapters or all sections in ophthalmology. Every section will be 20 questions, except for the public health and the pathology and the tumors. So there will be 20 questions in the general medicine, 8 questions in public health, 12 questions in pathology and the tumors. Then all chapters or all sections in ophthalmology will consist of 20 questions per each. So these are how is the clinical ophthalmology exam is formulated. Then we have another exam. It doesn't have a letter, but it is just called the advanced ophthalmology. The advanced ophthalmology, the first one that was in the previous years, it is called the advanced 115 exam. This advanced 115 exam, again, doesn't require any experience. It consists of 115 two types of questions are presented in this exam. One is called EMQs, or extended matches questions, in which the exam present a clinical scenario with different choices and different missing gaps. And for each missing gap, there should be multiple answers to choose in between these answers. So these types of questions called EMQs, and there are the regular or normal MCQs, which are single best answer of 4 choices, and this exam should be attempted in 3 hours. What is the syllabus? It will be the same, but there will be extra extended matches questions, like about 10 questions. So these 10 questions, if you are, there are 4 missing options in each one of these extended matches questions, and this will make these are these are considered like 40 questions. So community health, and these are 4 questions. Pathology and tumors, like 7 questions. Neuro-ophthalmology is 7 questions. So I can see that there are some questions. Can we postpone the questions to the end of the lecture so that we don't interrupt the flow of the lecture? The pediatric ophthalmology and strabismus is 8 questions. Cornea and external diseases, 7 questions. Lens and cataract, 8 questions. And oculoplastics, 7 questions. Glaucoma, 8 questions. And uveitis, 7 questions. And retina are 7 questions. So the total will be 115 questions to be attempted in 3 hours. And now there is not only the advanced ophthalmology 115, there is another. There are other missing topics. The low vision, 2 questions, and the medical ethics are only 2 questions. So low visual rehabilitation and medical professionalism are consisting only of 2 questions in this exam. Recently, the ICO has introduced a new exam called the Advanced Ophthalmology 180 exam. This exam doesn't again require an experience. It consists of 180 MCQs of higher level of difficulty. single best answer of 4 choices in 3 hours. You can see that the syllabus is the same like advanced 115, but it is just with higher quota of questions. So each kind of questions or each section is now consisting of more number of questions, and this is called the advanced 180. We will now discuss the how these are the different exams of the ICO. So what are, when you are finishing this exam, you are entitled the title FICO, or the Fellow of International Council of Ophthalmology. So how can you obtain this title? Let me tell you. First of all, you need to pass the visual sciences. Then you should need to pass the optics, refraction, and the instruments. Both of these exams can be taken together, as I told you earlier. And then you should take the clinical ophthalmology or part C. So this will be the sequence. And if you have done so, starting from 2019 and onward, then you will be eligible to have the title FICO, or to be a fellow of the International Council of Ophthalmology. So if you finished all these exams, part A and B and C, starting from 2019, then you will have this title. And if you have this title of the Fellow of International Council of Ophthalmology, then you are eligible for the title of Member of Royal College of Surgeons of Edinburgh. Again, this is a special case if they are passing all these exams starting from 2019 and onward. But what happens if you passed any of these exams before 2019, then you are required to pass the advanced exam, which was the advanced 115 exam. If you passed any of the part A and B and C before 2019, then in order to attain the title FICO and a member of Royal College of Surgeons of Edinburgh, you should pass the advanced 115, and now you are eligible, and you should present an evidence of face-to-face exam. This face-to-face exam can be like your master degree, your diploma, your board exam, whatever exam that are qualifying as a practicing ophthalmologist in your country. This will be an evidence of face-to-face exam. Once you have done so, you are now eligible for FICO, and you are also eligible to apply for the membership of Royal College of Surgeons of Edinburgh. But what is the problem now? The problem now is that the membership of Royal College of Surgeons of Edinburgh doesn't qualify you for GMC registration. In order to qualify for GMC registration, you need to sit for the advanced. So once now you have the advanced 115, now whether you are applied from 2019, before 2019 or after 2019, either with part A and B and C alone, or part A and B and C and the advanced 115, now you have the title FRCSED. If you want to apply for GMC registration, then you should now proceed to the next step, which is the Advanced Ophthalmology 118. And this Advanced Ophthalmology 118 should be, after passing the Advanced 118, you should now pass the final part of the FRCS Edinburgh, which is the Viva and the Clinical, or the FRCS Part 3. The FRCS Part 3, after passing it, then you are now have the Fellowship of Royal College of Surgeons of Edinburgh. And now what? Now, after you apply with the FRCSED and with the IELTS or OET, now you can apply for GMC registration and become registered within the GMC. So you may see that, oh, it is very lengthy pathway. So all these exams and finally to get the FRCSED, well, this we will talk about later at the end of lecture. Which pathway should we choose depending on what experience do we have and what are our goals by going to the UK. So this is the pathway of the ICO. this is the ICO with the common pathway between the ICO and the Edinburgh. So this is based on the recent collaboration between both of them. So I hope that this is clear. Let's now move to the next fellowship exam, which is the Royal College of Surgeons of Edinburgh. Again, what are the advantages and disadvantages of the Royal College of Surgeons of Edinburgh exam? First of all, it is relatively easier and shorter pathway, but this is before the third part. What does this mean? Meaning that the Royal College of Surgeons of Edinburgh doesn't have theoretical exams, and they liaised with the ICO in order that the ICO will take charge of the theoretical exams. And since the ICO exams are relatively easier than the alternative, which is those of the FRCS Glasgow or FRCOPHTH London, so the pathway is considered relatively easier than the Glasgow. Before the third part, it is considered easier and shorter. And why it's shorter? We just said that there are multiple exams. Yes, it is multiple exams, but they don't require experience, unlike the Glasgow. So the Glasgow requires 2 years of experience in the first part, about 5 years of experience for the second part. So if you are a fresh graduate, what to choose? Well, the pathway of the Edinburgh will be the better for you. The most advantage or the most striking advantage of exams of Royal College of Surgeons of Edinburgh that if you are speaking about the third part, if you fail in one station, you repeat only the same station. There is no need to repeat the whole exam as other exams in the third part. So we are speaking about mainly the third part, which is the only part organized by the Royal College of Surgeons of Edinburgh. But what are the disadvantages? First of all, the third part requires 4 years of experience, and it is more expensive pathway. And why is that? This is because of the plenty of ICO exams that you need to go through before reaching the final stage of the third part of the FRCS Edinburgh. Meaning that you need to pass the visual sciences and the clinical and the advanced 115, or if you are exempted from it, you need to pass the advanced 180. All these are costs that are a burden that you need to consider before going through this pathway. So it is not only about the money, it's also about the stress. You are going to the stress of many exams, so you should also consider about this. The third part of the Royal College of Surgeons of Edinburgh is considered the midway between the Glasgow and London in the difficulty, meaning that the Glasgow exam will be the easiest. Edinburgh exam will be the third part. Of course, I'm speaking about the third part. It will be the moderate in difficulty, but of course it's more difficult than that of the Glasgow. And the third and the London will be the of highest level of difficulty. And the huge disadvantage of the exams of Royal College of Surgeons of Edinburgh that after September 2018, the membership doesn't qualify for GMC registration. This was the great advantage. When I finished my membership, this like more than 5 years ago or 6 years ago, I finished it or I cleared it with the old system. So this old system was terrific. It was you can sit the first part with 1 year experience after internship, and then with only 6 months of of extra experience, you are eligible to sit for the membership of Royal College of Surgeons of Edinburgh exam, and you get licensed after that. And actually, I registered in the GMC with the membership even before I clear my FRCS Glasgow. However, this advantage is no longer available, unfortunately. So we have to deal with the current situation. Can you please mute your mic?
أنا وصلت يا ماما كويس. بسمع.
Okay. And one of the huge disadvantages also of the membership of of Edinburgh exam, that when you are ready now to sit for the third part after passing all the hurdles of the ICO exam, you are stuck now with very few centers for the final exam. Like now, the final exam of the Royal College of Surgeons of Edinburgh was conducted in the UK and in India, and recently even it is not available in India. So, and this actually has a reason, because there were no a huge number of candidates who are trying to sit for this exam because of its difficulty. I think that the Edinburgh will change this in the near future. Once there is a gush of candidates cleared the ICO exams and they need to sit for the third part of the FRCS Edinburgh, they will have to increase the number of centers. But till now, it is only in the UK and in India. Another disadvantage that I just spoke about, which is that it is more difficult. There are more demanding Viva and the clinical. This is the most lengthy Viva exam that you will ever encounter in all fellowship exams. It is even more lengthy than that of the London. So as I will show you now, it will be the longest day at your life is the Viva day in the FRCS Edinburgh. So here was the basic sciences and optics of the part A, but unfortunately this is cancelled after the ICO collaboration. And of course, and let me tell you, I sit for this exam already with my first part of ICO before it was cancelled. So unfortunately, I didn't get any benefit from it. And the Viva and the OSCE of the member of the Part B, which is was qualifying for the membership of Royal College of Surgeons of Edinburgh. Again, this was a very nice exam, and unfortunately, it was cancelled again, and it's no longer present. So what only we have related to the FRCS Edinburgh is the Part 3. So you are eligible to sit for Part 3 if you have 4 years experience and cleared the ICO exam and have the title of FICO and member of Royal College of Surgeons of Edinburgh. So what are the parts of this exam? This exam consists of 8 Viva stations and 3 OSCE stations. Just for the junior doctors who don't know what are these terms, Viva, it is a term for describing the oral exam, and OSCE is called for objective structured clinical exam, which is the clinical exam. So Viva is oral, OSCE is the clinical exam. And these are conducted over 2 days. So what is the structure of this exam? You have 20 minutes for each station, whether for Viva or for the OSCE. The first day, you are going to sit for 8 Viva stations, 8 oral exams in the oculoplastics and orbit, cornea and external diseases, cataract, glaucoma, retina and uvea, neuro-ophthalmology, pediatric ophthalmology and strabismus, and a weird session called the surgical outcome audit and research. And then you have to ask, there are some rumors that this session will be a bit modified, like there will be no longer an audit and they are be replaced. So we are still waiting to know what are the new regulations after the exam is open, because the exam is not open for the current time after COVID-19. The OSCE stations will be clinical stations for the anterior segment exam, clinical station for posterior segment exam, and clinical station for neuro-ophthalmology and motility. So this is the structure of the FRCS Part 3. And I made something to make you imagine how does this exam looks like, because many of you asked for this part specifically, and they want to know how does the exam looks like. So I didn't only bring you the structure of the exam, but I will make you now live the real experience of the exam. Okay, so you wonder how this can be done. Let's get started. Let's now assume that you finished the advanced ICO, and now you wanted to sit for the FRCS Part 3. You know, you now have 8 VIPA stations and 3 clinical stations. So how can you, how is the day will going to look like? I bring a previous candidate for this exam actual questions and actual exam and brought it to you so that you can visualize how does the exam looks like. So for 20 minutes, you are going to sit for the oculoplastic session, when you are asked about these questions or these topics. Then for another 20 minutes, you are asked about the cornea and external diseases in these topics, and these are actual topics that are asked in this exam by the same candidate. Then for 20 minutes, you are being asked about these topics. And for another 20 minutes, you are asked about these topics for the glaucoma. Is this enough? No, there is other 4 VIVA sessions. In the same day, for the retina and uvea, you are asked about these topics. For the neuro-ophthalmology, you are asked about these topics. For the pediatric ophthalmology and strabismus, you are asked about these topics. And the end of the day, for the surgical outcome, and audit and research, you are asked about these topics, about research, about consenting, about audits, about critical appraisal, and research methodology. So all this will be the first day in your exam. Then the second day, you are going to sit for you are going to enter 3 rooms. Every room has clinical, some patients with some clinical findings. So when you start with the anterior segment, you will find yourself examining a patient on a slit lamp, the first case, then the second case, and the third case. And when you are doing much more cases, this means that your performance is very good. Then you get out, and then you, after 20 minutes, you sit for the second room, will be the posterior segment. And again, you examine cases with the 90 diopter lens and the 78 diopter lens and 20 diopter lens with the indirect ophthalmoscopy with multiple cases of posterior segment. Then you are sitting for the neuro-ophthalmology and the motility exam. And you are checking case number 1, case number 2, case number 1 with neurofibromatosis, case number 2 with optic drusen, and case number 3 with Horner syndrome. And this will be the end of your exam of the FRCS Edinburgh. So what do you think? Okay, Dr. Ahmed, I will check the neuro topics again. So it is a lengthy exam, actually. As I told you, it is a demanding exam. So these are for the clinical, yes, for the clinical, they are real patients, and you should do the examination techniques on real patients. So no, there is no refraction required in the FRCS Edinburgh. It was required in the MRCS, but no longer required in the FRCS. So this will be the end of your exam in the FRCS Edinburgh. So what will be the pathway? What will be the pathway if you need to clear your FRCS Edinburgh? Basically, it is the same as we mentioned in the ICO. It is the same pathway of the ICO. We're starting with visual sciences, optics and refraction, clinical ophthalmology, advanced ophthalmology, MRCS Edinburgh, and then you clear the FRCS Edinburgh. Yes, the third part is conducted currently in UK and the India. And we don't have actual pass rate for this exam because there are no actual large number of candidates who are sitting for this exam. This exam was, there are people were so reluctant to join for the FRCS Edinburgh because it is difficult, it's expensive, it is, and it requires traveling to few centers in the world. And why should we do this? Why we just go for the FRCS Glasgow? Okay, so I think that we are going through much questions. Let's postpone the questions to the end of the lecture. Well, I will respond to your questions. Let's respond to your questions at the end of the lecture, okay? So unless you are something unclear in the presentation, please let me know. If you have a questions that is not present in the presentation, because I may repeat or I may reply to your questions or I may respond to your questions as we go. So just postpone your out of topic questions till the end of the lecture. Okay. For the FRCS Glasgow. Now we have some FRCS Glasgow, and there are what are the advantages and disadvantages of the FRCS Glasgow? The advantage is that it is for the first part, the main advantage that it has less optics. I know from my experience with my candidates that optics is sometimes a huge problem for many. So if you try to escape your way away from the optics, then FRCS Glasgow will be your choice. The third part is considered the easiest among the all fellowship exams. And when I'm saying that it is easier, this doesn't mean that it is a walk in the park and you will just go without studying or find good preparation and you will pass. No, it is just relatively easier than Edinburgh and London. So this will be a great advantage. It is the cheapest pathway because of the few exams. You can just in 3 exams, like the first part and the second part and third part, and voila. There is no other hassle or shortcuts or side pathways that you need to go through with the FRCS Glasgow. So it is logic that the fewer the number of the exams, the cheaper the price that you pay for these exams. The very important advantage of the FRCS Glasgow that it is increasing their test centers on regular basis. From 2 years ago, they added a test center in Malta, together with multiple test centers in Oman, in Jordan, in India, 2 centers in India, and in UK, of course. And so there are also some rumors that it will be also in Egypt. So multiple test centers, meaning that you will not be on the waiting list for too long. You are going to sit for this exam as soon as possible. And for me, for example, I was on the waiting list for this exam for 2 years. So this means that this exam has a lot of competition actually in order to secure a place. So what are the disadvantages? The disadvantage is that the second part, in order to sit for even the second part, not the third part, it requires up to 5 years of experience, or specifically 4.5 years of experience after the internship. So this is a huge number. Like, for example, if you sit for the first part and now you want to sit for the second part and you want to study, but actually you are not permitted to do so because you don't have enough experience. Even if you are excellent, even if you have very good clinical experience, but you didn't accumulate the amount of years of experience that they require. So the years of experience is only required before the second part, but for the third part, they don't require any experience because you already have the experience from the second. The huge disadvantage about the FRCS Glasgow is the emergency medicine. For some reason, those who are coordinating or moderating the FRCS Glasgow exams see that emergency medicine is an integral part of any ophthalmologist. So you shouldn't be an ophthalmologist without no knowledge about how to deal with medical emergencies. So they are asked about it in the second part and also asked about it in the third part. So in the second part, it will be asked in the written exam, and in the third part will be asked in the oral exam. The huge, again, disadvantage of the FRCS Glasgow is if you failed in a section in the exam, you repeat the whole exam. Meaning that in the part 2, it will consist, as we will see later, it will consist of a problem-solving part and the MCQ part. If you fail any part of them, you will repeat the whole exam. And in part 3, they have also some marking criteria. If you have a clear fail at 2 examiners, you will need not only to repeat the single exam, or if you have more than clear fail at 1 examiner, not only that you will repeat the station that you had clear fail, but you will also repeat the whole exam, the whole viva and the clinical or the OSCE. So this should be also considered, because it is not only effort, extra effort, but it's extra money, because you are going to spend the total amount of the payment when you are sitting for the FRCS Glasgow again, in contrary to that of the FRCS Edinburgh, where you will only pay for the stations that you failed. But again, the disadvantage that in the previous years, the problem-solving exam has increased in difficulty. So, as we will discuss in the study resources, we will see that there was a trend in the studying of the problem-solving exam, but this trend is now changing because of the changing the exam type and the difficulty level. There are few centers for the final exam for the FRCS Glasgow. For the few centers for the final exams are currently, it is considered relatively few in respect to, or with respect to the number of candidates, meaning that although we said that there are the most abundant, yes, it is most abundant than the Edinburgh, than London, but it is still not enough. They are still need to increase the number of their test centers, because they have a huge waiting list, and people tend to stay on this waiting list for a year or 2 years. This is a waste of time. More demanding viva and the clinical in terms of the emergency medicine. So the presence of emergency medicine in the viva, it is making it more difficult. And the clinical exam has 4 stations, in contrast to the only 3 stations in the FRCS Edinburgh, but the FRCS Glasgow has 4 clinical stations. And of course, as we mentioned, the long waiting list is an issue with this exam. So let's start with the first exam, the basic sciences and optics. It is this exam, in contrast to the ICO, it requires 12 months of experience after the internship. Also, it consists of larger number of questions. It is 160 MCQs, and with more choices. It is 5 choices instead of 4, which makes it more difficult. And now guess what? It is also fewer time. So instead of 3 hours of the ICO, it is only 2 hours. I don't really understand how possible this could be. This is, I don't know why they do this. For the ICO, they just present like 120 questions in 3 hours. And how could the number of the MCQs increase and become more difficult with the less number of hours? This is like strange. Anyway, the syllabus of the basic sciences and optics, they are examined, or they are both of them are tested in the same exam. So they will have the anatomy of 25%, physiology of 25%, pathology of 25%, and look at this: embryology, pharmacology, cell biology, biochemistry, genetics, and optics. All these are 25%. So when to choose this exam? If this distribution of marks is suiting you better. If you don't have a problem with the pathology, but have a problem with the optics, have a problem with the genetics, have a problem with the pharmacology, because they don't weigh too much marks in the exam. Then after passing the part 1, you are now eligible for part 2. And in part 2 requires, as I told you, 5 or 4.5 specifically years experience after the internship. So this is a large number for part 2 for a theoretical exam. And this is one of the main drawbacks of the FRCS Glasgow. This exam consists of two parts, the MCQ part and a theoretical paper essay part. The MCQ part is 80 MCQs, single best answer of 4 choices that are asked in 2 hours. And the problem-solving part is about 4 problem-solving questions that should be asked or should be solved or attempted in 2 hours and 15 minutes. These 2 exams are tested in the same day. Hold on, so Dr. Asad saying that it is 200 MCQs. Dr. Asad, 200 MCQs of the clinical of the MCQ part of the FRCS Glasgow, or do you mean ICO? Okay, let me check it. Maybe it is a typing error. So I will check it from the syllabus. So someone 160, 180, 200. So there is no fixed number. Okay. Okay, it's just I think this is a typing error. Okay, what is the syllabus? The general medicine 10%, the pathology and the tumors are 4%, neuro-ophthalmology 7%, pediatric ophthalmology and strabismus 6%, cornea and external diseases are 15%, lens and cataract 9%. Then oculoplastics makes about 12% of the exam, and glaucoma 9%, uveitis about 6%, retina are 21% of the exam. So there are like retina of the hereditary fundus dystrophy and the macula and the vascular disorders are making larger contribution in the exam. So this exam is really tough. It is not an easy one. And when you are finishing it, you take about 15-minute break, and then you sit for the second part of this exam, which is the problem-solving paper. So what are the problem with the MCQ paper? I will tell you now. So the problem-solving paper is consisting of 4 questions. 3 questions are related to the clinical ophthalmology, so they will present you 3 clinical scenarios in the exam and asking you questions about these scenarios. And then you will have the final question in this exam will be about medical emergency. As I told you, this is a problem about this exam is the medical emergency. There will be a single question. And the issue about this exam is passing this medical emergency problem-solving question is a pass or fail, meaning that if you fail in the medical emergency, you will fail in the problem-solving paper. And if you fail in the problem-solving paper, you fail the whole part too. So for me, this is like gambling. You are gambling with only one question. So this makes this part really, really unreasonable in the exam. Okay, so let's now say that you are cleared the part 1 and the part 2. Now you are eligible to sit for the part 3, which is the Viva and OSCE part. And in this case, you are not required of any further experience. You are just applying, you are just paying the fees and you are applying, and you don't need any further experience. This exam consists of 3 Viva stations and 4 OSCE stations. So it is more requiring or more demanding in terms of clinical skills and the clinical examination. It is conducted over 2 days. So what is the structure of this exam? For the Viva, there will be 20 minutes for each Viva stations. You will have a whole session or 20 minutes for the whole ophthalmic medicine. This will be a very, very extensive session that you will be asked about the whole ophthalmic medicine. The second session will be about surgery and pathology, but usually the examiners at this station ask about more about the surgery, not the pathology. Even the pathology will be maybe limited only to the retinoblastoma and choroidal melanoma. Hello, I'm back. Sorry for the interruption. So let's continue the lecture. And with the FRCS part 3, okay? So we were just saying that the FRCS part 3 consists of Viva exams and the clinical exam. The Viva exam consists of 3 stations for the ophthalmic medicine, surgery and pathology, and general medicine and neurology. And here is the problem. The problem is with the general medicine and the neurology, where you are asked about some emergency situations. Like, for example, in my exam, I have been presented an ECG and asked to interpret this ECG, and it turned out to be a patient with myocardial infarction. Or as far as I remember, it was not a myocardial infarction, it was unstable angina, and the examiner asked me if I would admit this patient for cataract surgery or not. Of course, this is not, of course, he shouldn't be admitted because the surgery can precipitate an attack of MI, and this is an elective surgery. So this is like kind of questions asked in this exam. As you know, this exam or this station specifically is moderated by an ophthalmologist and an internal medicine doctor. So you are actually asked by a doctor in the internal medicine. So this is the main hurdle about this kind of exam. The ask stations is 12 minutes for each clinical stations. Usually you see 2 patients or 3 maximum if you are excellent. It will be in the anterior segment and posterior segment, neuron motility. So these are the same of the Edinburgh, but in this exam, there is another session for the oculoplastics. So again, I will visualize this exam for you so you can figure out how this exam looks like, because I think that all of you will need this one day. Even if you are starting the first part or the second part, one day you will need this information about the third part. So I try to make it more memorable as possible, or as memorable as possible. So for you, first of all, you are going to sit for the general medicine and neurology exam, and okay, so back to the slides. So we said that there will be 12 minutes for each 5 stations and 12 minutes for each clinical station. So let's start our journey or our tour with this exam. You start your exam by the oral or the Viva exam with the general medicine and the neurology, and these are the actual questions asked by one candidate that he set for the Glasgow exam. So this will be for 20 minutes. And then you will shift to the other examiner who will ask you about the pathology and surgery. And this candidate was asked about these questions. And then the third session will be about the ophthalmic medicine, or the third station about the ophthalmic medicine. And you asked about ophthalmology from cover to cover. So these are the ophthalmic medicine. However, the pass rate in these sessions are very high because the questions are not that difficult. The level of questions in the FRCS Glasgow and the Viva, it is tolerable, or it is at the level of a general ophthalmologist. While that of the FRCS Edinburgh, it is at more subspecialized level. Now, after finishing this day, the second day, you will face 4 clinical stations or 4 clinical rooms. When you are sitting now for the anterior segment, you are examining the patient with a slit lamp. Most probably, the 12 minutes will only allow for examination and finding some signs in 2 patients, not more than this. Then you will shift to the next room for the posterior segment, and again you will most probably see 2 cases. For my exam, I saw 3 cases. It is very, very unlikely that you are asked to do direct ophthalmoscope examination for these patients. but it was recorded for some candidates. They are very lucky to have been asked to do direct ophthalmoscopy. And then the neuroophthalmology and the motility, you are again asked about 2 patients to do pupil examination, to do cover and cover, to do motility examination for these patients. And finally, the oculoplastics room, you will encounter patients with oculoplastic conditions like ptosis, like inoculated socket, and others. Okay, so what is now, if after we know now about the FRCS exams, what are the FRCS Glasgow exams, what are the pathway, or what's the pathway? You start by the part 1 or part 1 FRCS Glasgow. But actually, you don't need to start with part 1, as there are some qualifications, other exams that may exempt you from doing part 1. Like, for example, if you are still a house officer and you didn't still even complete 1 year of experience after the internship, then you can do the ICO part A and B, or you can do the FRCOPHTH part 1. Both of them can exempt from the part 1. Then if you pass the part 1 or an equivalent exam, then you are eligible to sit for the part 2 after, of course, the 4.5 years experience. However, there is the ICO clinical exam will exempt you from the clinical MCQ part of the part 2. So if you finish the first part and you are insisting to do the second part of Glasgow, and you are confused what to do in these 4 years, then you can do the part C of ICO or the clinical ICO. Then the part 3, you are now eligible for part 3, and the part 3, after passing the part 3, you have the title of the FRCS Glasgow, and after IELTS or OET, you can now be registered within the GMC. So this is the journey with the FRCS Glasgow. Finally, the last and the most demanding fellowship exam will be the Royal College of Ophthalmologists exam. What are the advantages about FRCOPHTH London? Please note that all exams or all the FRCS are called FRCS, or all postgraduate ophthalmology Royal College exams are called FRCS, except that of London. It's called the FRCOPHTH. So the main advantage that it doesn't require experience, but please notice, as it is mentioned on their website, that you are unlikely to pass if you don't have enough experience. So they didn't make a conditional experience, or they didn't make an obligatory experience required, but they know exactly, and you should know as well, that you will not pass this exam if you are not experienced enough. This exam is the best if you want to seek or if you are seeking the consultant jobs in the UK, meaning that if your long-term goal is to be a consultant in the UK, then this will be your route of or your best postgraduate qualification, or your best option to be registered in the GMC. But this is very important to clarify. Having or passing the FRCOPHTH doesn't make you a consultant in the UK, but it is one of the requirements to be a consultant in the UK. Again, let me clarify this more. To be a consultant in the UK, you have one of 2 routes. Either you have a training post in the UK, or you have an equivalent post to training in the UK. So whether you have a training post in the UK, or if you are started to have an alternative pathway to the training of the UK, then you should, or you have to pass the FRCOPHTH. It is a must within the training period in case of training post, and you can pass it at your own pace if you are in the equivalent pathway, which is called the Caesar pathway or Article 14, and we will speak about that in a while. So again, this is a misconcept at many candidates that think that after passing FRCOPHTH, I can be a consultant. No, you are just filled one tick box. It is only one tick box of more than hundreds of tick boxes required to be a consultant in the UK. The astonishing thing about the FRCOPHTH, or the astonishing news about the FRCOPHTH, that it was recently recognized as an acceptable postgraduate qualification for GMC registration. It was weird in the previous years that why the FRCOPHTH doesn't qualify for GMC. And I used to say this in my orientation lectures in the previous years, but now it is finally it is recognized by the GMC. So the previous route that I took, and many like me took, that we are just take or clear the FRCS Edinburgh or MRCS Edinburgh in the old system, or the FRCS Glasgow, and then put our selves in the UK system, and then if we want to be consultants, then we should seek the CSER or the Article 14 pathway together with clearing the FRCOPHTH. So this is a huge waste of time and money if you want to be a consultant in the UK, because you are sitting now for 2 exams. You have FRCS and you need now to clear the FRCOPHTH. But from now, if you want to be a consultant in the UK, then you don't need to go through FRCS Glasgow or Edinburgh. You just go for the FRC of London. But of course, this has a huge difficulties we will talk about now. Also, one of the advantages of this exam is that it has many exam dates. It is conducted, since it is the legitimate route for the consultants in the UK. They are aware that this is the only route to be a consultant in the UK, and of course they need consultants. So this exam is performed or conducted regularly all over the year. Like, for example, the part 1 can be conducted up to 4 times per year. This is not present at any fellowship exam. And also the FRC of the final part is also conducted many times per year. And availability of test center for the theoretical part, meaning that this exam consists of theoretical part and the practical part. And theoretical part are present at many centers all over the world. And also for the current time, it can be conducted online. It goes without saying that these are the hardest exams. These are extremely difficult exams, and we don't say that it is impossible exams or they are impossible exams, but you should think more than once before trying to attempt these exams, because you should ask yourself if you really need these exams. So because they are the hardest, you should consider if there are any other alternatives which are more easy, more time and effort saving. So if there are other alternatives are better for you, go for them. If not, and if you really want to know what are the main advantages, or you really want the FRC of London by its name, okay, then you should prepare very, very well for it. One also of the disadvantages of the UK, and if we are analyzing why these exams are difficult, because actually they are exit exams in the UK healthcare system, meaning that when an ophthalmology trainee enter in the training system in the UK, they are required to pass these FRC of London exams throughout their 7 years. So the final part of this exam is equivalent or is offered to UK trainee at the ST7 or ST6 level. So they are expected to have 7 years of experience in the UK system. That's why they are difficult, or they require high level of experience. So what I'm going to advise you, if your level of experience or your level of or training at your country is not equivalent to 7 years of experience of the UK system or of a parallel system, then try to think more than once before sitting for this exam. So I hope that you understand why this exam is difficult, because this exam will qualify a consultant So a consultant in the UK can be service manager, can be direct lead manager, can be head of department, can be director of hospital, can be many positions. So this will be the exit. This will be the higher qualification that no other qualifications after it. And also one of the drawbacks of this exam that you may, if you are thinking about taking this exam at your home country, like I'm speaking about part 2 specifically, not part 1, then you should again think more than once, because this exam test is mainly done or mainly conducted for the UK trainees. So this test analyze and test their awareness of the UK health system and the current issues of the NHS. So almost all of my colleagues who did this exam are working in the UK, because not everything is present in the books. Not every information you will learn from the books. There are inevitably you will have some issues that you will not be aware unless you are working in the system. So these are again, this is not present in the MRs in the Edinburgh and the Glasgow exams. So you should again consider this point. The refraction certificate is a bit demanding for the FRCOPHTH, and unlike, for example, though when I set the refraction exam in the MRCS Edinburgh, it was only refraction of 1 patient. But here in this exam, as we will see now, it will be plenty of patients. Okay, so starting with part 1. The part 1, as I told you, doesn't require any experience, not the part 1 or any other part. The older system of this exam is that the exam was consisting of 2 parts. An MCQ exam of 160 MCQs, and by the way, the second or the clinical part of the FRCS Glasgow is 160. Okay, 160. This exam in the previous system was 160 MCQs, single best answer of 4 options in 2 hours, and a unique exam was called the CRQ exam, or constructed responsive questions. This is like an essay exam that was presented to these candidates in 2 hours, and asking about to write an essay or write short notes about different topics in the basic ophthalmology and ophthalmic investigations. Fortunately, this exam was a bit difficult. Fortunately, starting from the January 2021 exam, this exam will change. Meaning that starting from the exams in the next month, the exam will be conducted as 2 papers, 90 MCQs, single best answer of 4 options in 2 hours, followed by a break. Then another paper of 90 MCQs, single best answer of 4 options in another 2 hours. So this will be the new system of the part 1. So what are the topics asked in the part 1? Here, the topics are very extensive, or covering a huge area of basic ophthalmology, and not only basic ophthalmology, but patients investigations as well. Meaning that you are asked about the anatomy in details or extensively, general physiology asked in extensively, ocular physiology, vision, cell biology and biochemistry, general and basic ocular pathology, immunology, microbiology, pharmacology, optics, refraction and instruments, of course, epidemiology and biostatistics, genetics, patients investigations, which are like you are asked about the fluorescein angiography, the OCT, biometry, and the others, and the corneal topography and others. And you may ask, why should I be asked in the patients investigations in a basic exam? Again, let me repeat to you that these are the qualifying exams for UK trainees. And this exam, although it doesn't require experience, but it is made at a level of SCT 2 or 3 experience at the UK, meaning that those who are sitting for these exams are expected to have to be in 2 years in practice. So they test at this level. They test candidates who have 2 years at least of practice. So if you have 2 years of practice, you are most probably encountered a lot of patients investigations, so you are asked about them. Then after you pass the first part, you are sitting for the refraction certificate, and this again doesn't require any experience. And this refraction certificate is composed of 10 OSCE stations in 5 rooms. So 10 OSCE or 10 objective structured clinical examination in 5 rooms. You spend 10 minutes in each room. So this means that there will be two OSCE stations in each room. You can divide your time or divide the 10 minutes between the two sessions or two stations as you want. The structure of this exam: in the first room, you will do cycloplegic refraction of the patient to 2 eyes. You should spend 10 minutes in this exam. In the room 2, you should do cycloplegic refraction of patients to 2 eyes again in 10 minutes. So this will be the same. In the third room, you should do non-cycloplegic refraction of patients to 2 eyes again within 10 minutes. In the fourth room, you do subjective refraction of patients 1 eye, cylinder only. So you will do cross cylinder and you verify the cylinder of the patient, and you do lens neutralization. Maybe use with or without the lensimeter or the falsimeter. Again, those 2 sessions will be in 10 minutes. And finally, the fifth room will be subjective refraction of patients 1 eye sphere, and further refinement, like for example by fogging or by duochrome test, and do binocular balance to detect if the patient has any heterophoria or heterotropia. And this room again, you should spend 10 minutes in this room. So this exam is done in Singapore and in London only. And so you should travel to do these exams. Part 2, London. After passing the part 1 and the refraction certificate, now you are eligible to sit for the part 2. For the part 2, it consists of 2 parts: theoretical part or a written part, which is consisting of 180 MCQs, single best answer of 4 options in 4 hours, and this is the structure of the part 2. The part 2 is measuring or asking about or testing your knowledge about patients' investigations, all these investigations, and your knowledge about patient management. That's why I'm telling you it is difficult to do this exam if you are not aware by the UK system. So you do the patient management and some practical skills, again asked about them in the MCQ. And again, you will be asked about basic and the clinical sciences. So again, you will be asked anatomy and physiology and biochemistry. And they give you a note that although these basic sciences have been already assessed in the part 1 FRCOPHTH, but the learning outcome of these should be also assessed in the part 2. So you should prepare accordingly. Not only this, but you also asked about health promotion and disease prevention, and asked about some surgical skills and continuing professions and personal development. So this is the curriculum of the MCQ part. When you pass it, you are eligible to sit for the final part or the oral part with 5 VIVA stations and 6 OSCE stations. What are the structure of these VIVA stations and OSCE stations? So the VIVA will be about patients' investigations, a station about patient management 1, another station about patient management, a station about attitudes, ethics, and responsibilities, and another oral session about audit, research, and evidence-based medicine, and health promotion and disease prevention. For the OSCE, you are asked about or you are examined on segment clinical cases, glaucoma session or OSCE station for glaucoma and lead, OSCE station for posterior segment, OSCE station for strabismus and orbit, and OSCE station for the neuro-ophthalmology. And if you pass this exam, you are entitled the FRCOPHTH London. And and there is another missing station, which is the communication skills. Okay, so there are 6 OSCE stations and 5 VIVA stations. So as you can see, it is a demanding exam that requires a high level of experience. And so what is the FRCOPHTH pathway? Again, all these parts doesn't require any experience. When you sit for the part one, you are eligible to sit for the, or you pass the part one, you can now pass the refraction certificate. And if you pass the refraction certificate, you are eligible for part two, MCQ part. If you pass, you are eligible to sit for the oral part. And now you are entitled to the title FRCOPHTH. And with the IELTS or OET, you can have the GMC registration. But please notice that when you have IELTS or OET, this doesn't mean that you are registered in the GMC as a consultant. This is very important. You are registered in the GMC as a middle grade, like middle grade, or you can apply after this with the middle grade jobs. But if you are in the training system, you can apply for consultant jobs and you enter in the specialist register of the UK medical system. Okay. Well, for the centers, you can refer to the official website, and for the fees, as they are always changing. I didn't want to make this lecture is very large because the amount of information is huge actually, and we still didn't finish. Maybe we can arrange another more in details lecture for each one of them. Now, let me give you an idea about the job market situation of the UK. When I first registered in the 2016 and I was applying for jobs, I was almost, not almost, I was always accepted in every job. Not because I'm super wow and I'm super ophthalmologist, but actually because the shortage was huge. So it was a very huge shortage. There are areas in UK that there not even a single ophthalmologist were applying to them. So they can take whoever is applying. I remember that there is a job that they asked me about any difficulties that I might have. I told them I have a difficulty with dealing with pediatric population. So the interviewer told me, well, we are actually, or basically, we are a children's hospital. The majority of our population or our patients are children. And I was convinced, totally convinced that I will not be accepted. And the surprise that immediately after the interview, I received an email that I was accepted. So this was the situation previously. But now what happens? What is the current job market situation? Well, still there is a shortage. There is still demanding areas. There are still areas that needs ophthalmologists to apply, and areas that are lacking good or lacking ophthalmology service, and they are still need for the international doctors. And I don't think that this is going to change in the near future. Still, there will be demands, and there still will be the international doctors will contribute a lot to the NHS system. However, the bad news is that the competition is also rising. As I told you, when I applied in 2016 for the first time, my CV was not that good, not like now, and I was accepted in every job that I applying for. For current now, many people are complaining in the groups and in the closed rooms that there are no jobs. But actually, it is not there are no jobs, there are huge competition. Like, for example, let me tell you about my current post. For my current post, I applied with other ophthalmologists, I've been shortlisted for interview. And well, I'm trying to close the mics, but let me trying to mute everyone. Okay, so I was speaking about my current post. So My current post, I was interviewed with other ophthalmologists, and I was selected. After the interview, I was offered the job. And when I was searching about some ophthalmologists, some colleagues that are working in the same hospital, one of them, I was able to reach one of them, and he told me that I was interviewed among 40 ophthalmologists. So can you imagine the competition? It is one ophthalmologist that is selected out of 40. This is large number. So I don't want you to be frustrated. So you think that the competition is high, so I will not be able to get myself in. No, there is still a room for you, but you just need to work on yourself. It is not only about the qualification. It is not only about the FRCS or the FRCOPHTH. You need to work on your clinical skills, your surgical skills, your research skills. All these, because actually when sitting in the interview, it doesn't matter who have FRCOPHTH, who have FRCS. What really matters is your communication skills, your clinical and surgical skills. How will you present your skills? How will you fit in the team? All these are the criteria that are assessed in these interviews. So don't be scared of the competition, and I'm aware that almost all of you have very, very good clinical experience, and they will do very well in the interviews. So just think of the qualification as a way to get GMC registration. But for applying for jobs, there are other parameters to be assessed. Okay. Now let's start with the best way for GMC registration. Now you got confused about all these pathways and what is the best suitable option for me? How can I choose my best pathway to get GMC registration? This pathway should be time saving. You shouldn't stay all your life studying for postgraduate qualifications, but this is just only a step at your life. Should also save your effort. So what is the best saving effort? As I will going to illustrate now, what will be the exams that are easiest? So you should, or you may consider them to save your effort. As a tip that I told you, that if you want to be a consultant, then no need for going FRCS Glasgow or FRCS Edinburgh, then going again to FRC of London, because not even a single exam in FRCS Glasgow or FRCS Edinburgh will exempt you from any part of FRC of London. You will have to repeat all parts of the FRC of London, and this is like the dilemma I'm stuck in right now. So you have to start all over again. We have to start from the scratch with the basic sciences, and so this is a huge waste of effort. So knowing or the knowledge of your desired goal will save you a lot of time and effort. And also you should consider the money, because this is like a long journey, and you should pace yourself. You should know what is the cost of this journey, because it will be totally useless to start the journey and will not be able to continue. Because first part or second part without the third part, it is useless. Nothing you gain from them. Okay, so let's say that you are a practicing ophthalmologist, or let's say I made this flow chart, or I will present to you a flow chart in my mind, or to my humble experience, that I will think that this flow chart will be useful for you to make a decision which exam you should go through. So let's say that the first question, are you a practicing ophthalmologist? In the current time, are you practicing? Do you have any clinical experience? Well, if you are not practicing ophthalmologist, for example, if you are still house officer, or if you are working in another career beside medicine or instead of medicine or instead of ophthalmology, and this happens a lot, by the way, don't be surprised. I know many ophthalmologists or who were ophthalmologists, but now they quit ophthalmology and are shifting to other career and thinking of a UK system as a gateway to return back to ophthalmology. So again, are you a practicing ophthalmologist? If not, so are you going to practice soon? Like for example, if you are house officer and you are waiting for your residency in ophthalmology, or it is not expected that you are going to practice soon. Like if you are shifted your career to another career or shifted your career to another specialty, and you don't know when you are going to practice. So if no, here is the surprise. If you are not practicing and you are not going to practice soon, does this give you any chance of putting yourself in the UK system? The answer is yes. But how? With the PLAB exam. So what is the PLAB exam? The PLAB exam is just a general exam in the general medicine and surgery and other subspecialties that will give you a GMC registration at a junior level. So the PLAB exam doesn't require any experience, and it is an easy exam that you can sit like about the part 1 and part 2 in 1 year, and you can get the GMC registration at that time. So this will be the shortest, the most time saving, the most money saving, the most effort saving for you if you are not going to practice soon. So why wouldn't all ophthalmologists do PLAB exam if this is the case? Because you are now registered in the GMC at the junior level, and as I told you, the jobs are competitive. So the jobs require you to have high level of experience or more level of experience. So if you are done with PLAB alone with no experience, your chances of getting ophthalmology post are not that much. Like, let me tell you that in 2016 and like 4 or 5 years, I know some ophthalmologists who get ophthalmology post with PLAB. They didn't even do any FRCS or FRCOPHTH exams. But for the current time, no, it will be a little bit difficult. But it is better than nothing. Because if you are not practicing ophthalmologist and you are not going to practice soon, well, your chance of passing the FRCS or FRCOPHTH exam are very, very weak. So in order not to stuck in FRCS or FRCOPHTH exams for long years, try to sit for the PLAB exam. It will clear your pathway in much more rapid time. Okay, let's say that you are going to practice soon, or you are going to practice. So the next question, does your practice entail excellent training? Like you are going to practice in a tertiary referral hospital or a university hospital. So you are thinking, or there is good chance of having excellent training, or not. Like most of us, like training in ordinary hospitals, then the answer, if it is no, if your training is not excellent enough, then go for the ICO exam. Because ICO exam, if you are not practicing and you are going to practice soon, then the ICO doesn't require any experience. So you will not be eligible to do the FRCS1. But you can do the ICO Visual Sciences and Optics. This will be the easiest exam, so it will save your effort and it will save your money, and also it will save your time. So you don't need to wait for a year of experience like FRCS Glasgow. And also this is easier because your training is not that excellent. But if you have excellent training, and by excellent training I mean something like comparable to the UK system, then I encourage you to sit for the FRCOPHTH Part 1. For the FRCOPHTH Part 1, you will be this will be your best option, because now your excellent training will make you having good or very good clinical exposure, and maybe after you said the first part, you can practice for retinoscopy and refraction, and you sit for the second part, and you postpone the second part till you, for example, have much more clinical experience. So you may do clinical attachment in the UK. By the way, when I say that the part 2 requires some UK experience, this doesn't mean to have, this doesn't mean to be an actual work in the UK. If you just went to the UK like in a scholarship or in elective or in clinical attachment, you will get immersed in the UK system, so you will know what it takes or what it need, what is important to know for the second part of the FRCOPHTH. Okay, let's say now that you are already practicing, like most of you are already practicing ophthalmologist. So I think that the crucial question to ask here is, what is your aim from working in the UK? Not all of us have the main concerns and the same concerns and the same goals from working in the UK. I think I can summarize the work from the UK, or your desire to work in the UK, I can summarize them into 4 main goals. First of all, you want to be a consultant in the UK. The second of all, you want a fellowship. The third of all, you need life quality. And the fourth is you need financial income or financial reasons you want to go to the UK. So does it differ or does it make any difference when you are specifying or you are know what is your goal? Yes. If you want to be a consultant, meaning that you have long-term plans in the UK, you either you're set for the training post despite their difficulty, or you are sitting for, or you are going to pass, or you are going to collect the competencies needed for Article 14 or the Caesar pathway. So again, this will needs time and dedication and a very, very hard work. But if this is your goal, if you want to be consultant in the UK and pursue your career later in the UK, then it is the FRCOPHTH. Then you should invest every single time, money, and effort, every single piece of time and money and effort for your goal. Don't be distracted by other exams like FRCS, Glasgow, or Edinburgh, or ICO, whatever. Don't be distracted. This is just this is your route. This is what will give you the best long-term outcome, is to do the FRC of London. Okay, but some of us don't want to settle in the UK. They just want a fellowship, meaning that they want sub-specialty training in the UK. Like, I want to be a corneal surgeon. I want to be a vitreoretinal surgeon. I want to sub-specialize in the oculoplastics. But I don't want to stay the whole or the rest of my life in the UK. So what is the best option for you? It is the fellowship. Okay, so for the fellowship, it is like a sub-specialty training for 1 year or 2 years that qualifies you as a higher level of sub-specialty experience in this level. But after finishing fellowship, this doesn't mean that you can work as a consultant in the UK. This is very important. But it is just this fellowship gives you the skills that are required for this sub-specialty. So what will be the best option? The best option, if you are planning for a year or 2 years of sub-specialty training in the UK, will be the FRCS Glasgow and the FRCS Edinburgh. And why? And let me tell you why. For 2 reasons, actually. You may think, okay, if I wanted to go to the UK and just do a year or 2 years in sub-specialty, why wouldn't I go for PLAB? Because PLAB, meaning that you don't have enough experience, and fellowship posts or fellowship jobs are very, very, very competitive. They are the highest competitive jobs after the training jobs. So you should demonstrate that you have higher level of experience and higher level of qualifications as well. So you may think, okay, then why wouldn't I go for the FRCOPHTH? Because those who are accepted for fellowship posts are having, or almost always, they have already experience in this subspecialty in their home countries. For example, like for me, for example, I have, for example, 3 or 4 years experience in the cornea. So I'm a cornea surgeon. And when I am applying for fellowships in the cornea, but the cornea fellowships are very competitive. Why would they choose me? They will choose me because I have already an experience in the cornea. Okay. So, okay, and so what? So what's the problem? Again, you didn't. You may think, okay, but you didn't reply to my question. Why would I think of FRCS Glasgow or Edinburgh, not FRCOPHTH? Because if you are stuck in a subspecialty for the last 2 or 3 or 4 years, you are most likely have forgotten the other subspecialties. Like, for example, if you are a cornea specialist or a cornea consultant, well, what will be the last time you do cover and cover test for a patient? What will be the last time that you did a motility examination for a patient? Long time. So meaning that your experience in other subspecialties will be not that good. So in order to increase your chance of passing the exam, you should go for the easiest FRCS exams. You should go for the FRCS Glasgow or Edinburgh. But for the FRCOPHTH, this is a very demanding exam, and you don't need it. This is the trick. You don't need it if you just want a fellowship. Okay. So just go for the easiest exam that will make you reach your goal. Okay, so what happens if you are just not sure? You are just didn't go to the UK yet and you don't know what to choose or what are your goals? You are still confused. Most probably you are seeking a better quality of life, or you are seeking better income. So, for example, you are seeking for better health services for you and your family, better education for you, for your children, better quality of life in terms of lifestyle. Then you should go in the midway. You shouldn't go for the FRCOPHTH as long as you don't want to be a consultant, but you just want to live a happy, normal life, because consultants are very demanding. So or PLAB, of course, because PLAB it will be, and you are practicing, and the PLAB will not get you the post that you want. So just to start, you choose the FRCS Glasgow or Edinburgh. And again, if you want just to improve your financial income, like if your income in your country isn't that good, and you want to improve your income, again, go for the FRCS Glasgow or Edinburgh. And by the way, in the income in the UK is not that high, but it will make you live very, very well. So you can do whatever you want. You can live very good quality of life, and you can travel. You can buy a car. You can do whatever you want. But your savings will not be that much, especially if you have a family. And if you are thinking about money as a goal per itself, not you are not thinking of career development, then UK will not be the best option. Okay, so in the UK, money is not that high. But let me tell you something. When you are considering doing the FRCOPHTH exam or the FRCS exams, one of the main hurdles or the main drawbacks that will set you back will be the money. How can I finance these whole exams? Well, let me tell you that these whole exams will be, or from the first salary that you get in the UK, you will compensate for all the exams that you are examining during your whole life. So you can consider it like an investment. You are investing in yourself by doing these exams, because with only single month in the UK, it will award you back with the whole fees or the whole money that you paid through all these years in all these exams. So think in like that way, and it will be much better, and will make you much forward thinking, and will grant you much more career progress. But don't be pessimistic about that. Okay, so now you know what are the different kinds of exams, what the exam to choose, and and depending on what is your goal from going to the UK. But now you should know what are the cross pathways, what are the different pathways, how can you go from one exam to the other. So this is the ICO part A and B and C and advanced, FRCS Glasgow part 1, 2, and 3, FRCS Edinburgh part 3, FRCOPHTH part 1, refraction certificate, and part 2. So ICO, the first part, or the visual sciences and optics, can exempt you from the FRCS Glasgow, meaning that if you don't have enough experience, you can start with the first part or the part A and B of ICO, and then jump to the second part of the problem solving if you want. Also, part C of the ICO will exempt you from the second part, from the clinical MCQ part of the ICO of the FRCS Glasgow exam. Okay, and also the FRCS Glasgow will exempt you from the first part of the ICO. So you can sit the first part of the FRCS Glasgow and then sit the clinical exam of the ICO. Okay, so now we know about this exemption. And also the FRCOPHTH London, if you have part 1, it exempts you from the first part of the FRCS Glasgow, and you can sit directly the part 2 London, part 2 Glasgow. And this is the unique thing about FRCOPHTH London. If you pass the FRCOPHTH London, you can complete either Glasgow pathway if things got worse, or you can complete the FRCOPHTH London pathway. So speaking about the cross pathway, what are the differences, or what are the differences between the first part of the ICO, Glasgow, and London? Let's compare between the part A and B of ICO, part 1 of the FRCS Glasgow, part 1 of the FRCOPHTH London. Regarding the experience, no experience required in the ICO, but there is 1 year of experience required in the first part of the FRCS, and no experience required in the FRCOPHTH. Regarding the difficulty, ICO will be the easiest. The FRCS will be moderate difficulty. FRCOPHTH will be the higher level of difficulty. Regarding the fees, the ICO fees will be like about, as I told you, they are changing from country to country and from that of the website, but they are usually around the range of $450. The FRCS Glasgow Part 1, it is the same fees in sterling pounds, like usually it is more or less the same like the ICO, but the FRCOPHTH has double the price. It's like about 620 pounds, or so this will be like about $700 or $800. So it will be like double the price of the ICO and the FRCS. So you should think carefully about the FRCOPHTH if you really need it, because it's expensive exam, it's a difficult exam. So what are the special advantage of each one of these exam? Why would you think this in this exam particularly? The special advantage about the ICO that it has a separate basic sciences and optics, meaning that you can pass the basic sciences alone and you can pass the optics alone, or you can divide them into two lights. So you can sit in April for the basic sciences and sit for the optics in October. This advantage is not available in any other exam. Okay. The unique thing about the FRCS Glasgow that it has a minimal optics questions quota. As I told you that the optics questions are the minimal in the FRCS Glasgow. Well, the unique thing about the FRCOPHTH is that it is the only exam that can be considered as a hub. You can continue from it in the FRCOPHTH London, or you can continue in the FRCS Glasgow if things got worse. Okay, so this is the cross pathways again. So now we have another confusing two exams. It will be the Part C clinical ICO or Part 2 or the clinical MCQ of the FRCS Glasgow. So let's compare. For the experience, again, the ICO doesn't require experience. For the MCQ part of the Part 2, it requires experience. Actually, it requires long experience of about 4 to 5 years. Difficulty, the ICO considered easier than the FRCS Glasgow. And this is because the ICO have questions banks, and there are a lot of repetitions from these questions banks, which makes the ICO much more easier. The fees of the ICO are like about higher than the MCQ part alone of the FRCS. So again, you should consider this. If the fees are an issue, then you may consider to do the whole second part of the the MCQ and the problem solving together, because the whole part two, it is the fees of the whole part two is maybe something near to the part C or the clinical ICO. Special advantage of the clinical ICO that it is a shortcut to the FRCS2, meaning that if you doesn't have the enough experience required for the MCQ part of the FRCS Glasgow, you can take the part C ICO, and also the special advantage that it has a question banks. FRCS Glasgow doesn't have questions banks. So who is the FRCS Glasgow Part 2 for? It is best for those who have limited time and money. For example, let's say there is an ophthalmologist who is well trained, like about he finished his residency like about 4 or 5 years, and he is now want to clear one exam, single exam, in order to get the second, in order to be ready for the third part. So he is not willing to wait to do the clinical exam at one date, like clinical ICO in April, and wait to pass, then apply for the problem solving in October. So he doesn't have time. He has limited time, and also he has limited money, because those exams or doing the second ICO, then the problem solving will be more expensive than doing the second part as a one package. But as we said, the drawback will be the emergency question, and if you fail that in it, it will make you fail the whole exam. Okay, so this is the cross pathways between the second part. The third part doesn't have any cross pathways. So for every exam, there is nothing that will make you take or eligible for the third part unless you already pass through the pathway of this certificate. Okay, but one of the main issues, or one of the main questions that all of you or many of you thinking about, well, after I finished my advanced exam, or after I finished part C ICO, and should I go for the advanced exam and go through the FRCS Edinburgh pathway, or shall I go for the problem solving exam and go through the FRCS Glasgow pathway? So although they are different exams, but let's compare between both of them. Well, ICO again doesn't require any experience. The FRCS problem solving requires 4 to 5 years. Difficulty, well, this can be a little bit debatable, but in my opinion, well, the ICO will be easier than the FRCS. Why? Although some of you who are already set for the advanced 180 and they claimed that it is difficult, and for me I saw some recalls of this exam. I don't see that it is difficult, but I can see that it requires some level of experience in practice, because not all the questions you can read in books. Again, some at the end of the day, some questions requires that you have some clinical experience. So what makes the ICO easier, in my opinion, that it is more or less it is an MCQ exam. So you have a chance, let's say, to 25% chance of having every question right or wrong, or you have 25% chance of every question to have the right answer. But in the FRCS Glasgow, if you don't know the answer, you have 0 chance. So, and if you failed in the medical emergency, again, you have 0 chance. So this what makes FRCS, to my mind, is problem solving part is more difficult, and failing the problem solving, if you are sitting again for the whole exam, you make you fail the whole exam if you didn't pass the problem solving part. Okay, so you should consider this. The fees, well, I don't think that the fees will be an issue in comparing between both of the exams, the advanced 180 and the problem solving. Both of them almost like the same fees. The special advantage of the ICO, as I told you, it is easier. And the special advantage of about the FRCS that it has more recalls, meaning that there are some recall questions from the problem solving previous papers in the last 5 years, which sometimes can be repeated and they can give you a clue about how does the exam look like. This advantage is not yet available in the advanced 180 because it is only we have the last July and last October exams. We don't have much exams, previous exams of the advanced 180 questions. So we don't still have enough experience about this exam. So this is the second part, and for the advanced part, there are no cross pathways, as I told you. Well, but we can still compare between both the three parts. Experience, the Glasgow doesn't require any further experience after part 2. Edinburgh require 4 years of experience. FRC of London doesn't require experience. Difficulty, Glasgow will be the easiest. Edinburgh will be moderate in difficulty. London will be the highest in difficulty. The fees will be, I think that the fees are almost the same between all of this exam, being the Glasgow slightly lower and the FRCS Edinburgh slightly higher, with the London also slightly higher, but this is not a concern at all. Special advantage of about Glasgow, as I told you, it is the multiple test centers, so your chance of getting accepted for the FRCS Glasgow is higher. And also they are now considering online exam due to the COVID-19, and those who have their exam postponed due to COVID-19, they will have the chance to sit this exam online, but this will be like in January, and we still don't know any idea about how does this online exam looks like. But I don't think that this will be a permanent issue or a permanent change that will happen after that. The main advantage or the special advantage about the FRCS Edinburgh that you can repeat the fail station only. This is the huge advantage of FRCS Edinburgh. The advantage of the FRC of London, that it will, when you finish it or you clear it, you are now you are finished one of the important criteria that are assessed in your application for consultant jobs through the Article 14. So the Article 14 or the CESAR pathway, it is like a large number of competencies and the skills and the qualifications. When you are finishing the FRCOPHTH, then you have already ticked in this box or this box regarding the qualification. Okay, we will go through the study materials very quickly. For the basic sciences and optics, this can be like the ICO part A and B, FRCS Glasgow part 1, FRC of the part 1. The main study sources, you can study from some notes like these notes by Dr. Muhammad Omar, but you need to supplement these notes by the anatomy of the visual pathway and the cranial nerves and the bone of the skull by the Snell's anatomy. And soon we are going to publish our own made notes for the anatomy. This will be going to be published soon. For the optics, the last exams are showing that the optics questions are increasing in difficulties. So the main source for studying the optics will be Ilkington, and it should be supplemented by topics from the clinical optics of the American Academy, like the refractive surgery, like the contact lens. And again, our notes for the optics will be published soon, so stay tuned for it. For the basic sciences, for the physiology, there is an illustrative book called Shaheen Physiology, which is basically the summary of Qurana. This is the famous Qurana book for the anatomy and physiology, and we have already our made physiology notes, which will provide them for our registered candidates. For the basic sciences, other basic sciences like pharmacology, pathology, immunology, and microbiology, the The standard book is the basic sciences for ophthalmology. However, in the last exam, it showed a higher level of difficulty in these topics. So again, you should supplement your study from the Basic Sciences in Practice by John Forrester. And again, we have our already made notes for pharmacology, microbiology, genetics, pathology, and immunology. Now, these are the books for the study. Now you need to practice, or what are the books for the MCQ? The most two important books will be the Master Pass and the 400 single best answers and CRQs for the FRCOPHTH. These are the two main or the two important books. If you have still time, or you want to increase your exposure to the MCQ, you can do the clinical sciences, the basic sciences by Arnold. So this again will be a clinical, a basic sciences MCQ book. For the optics, the most important will be the self-assessment test by Showa, the same author of the Showa website, and the MCQs by Behan, and the optics, or the MCQs in optics by Arnold. So Arnold have two books for basic sciences and for optics. For the current year, the previous years, what I noticed that there is an increasing tendency to bring MCQs or ideas of MCQs from the MCQ online banks, like for example the iDocs and for the FRCOPHTH.com. So I encourage you also to check on these MCQs and present in these resources, because they are shown to be of increasing importance the previous years. Okay, what about the clinical MCQ? If you are sitting for the clinical MCQ like ICO Part C or FRCS Glasgow Part 2 or FRCOPHTH Part 2, then I always recommend that the best resource, if you have time, will be the American Academy of Ophthalmology clinical curriculum, or basic sciences and the clinical science curriculum. So you study only the clinical science curriculum. So this will be the best resource. To my mind, the second best resource will be Yanov in ophthalmology, but again, time will be an issue because it is a more large resource. But if you don't have time, then Kansky will be your option. I don't recommend the Oxford for the clinical MCQ because it lacks a large number of information, and also it lacks images. So in the clinical MCQ exams, you are asked about some clinical photos, investigations, and these are not present in the Oxford. Okay, so let's say that you don't have time. You don't have time to go through all these textbooks. Then your second option is to go through the review books. These are the review books. Review books are kind of ophthalmology textbooks that summarize the ophthalmology topics in short way. And so it will save your time by just giving you the most important information about each disease. You can go for the review manual by Neil Friedman, or of the ophthalmology review manual by Kenneth, or ophthalmology review manual by Massachusetts Eye and Ear Infirmary. You can choose any one of these books if you don't have time and you want a rapid review of ophthalmology topics. For the advanced 100 and advanced exams, and for the FRCOPHTH Part 2, there is more tendency to ask about the clinical studies and the trials in ophthalmology. So these are you should go through these trials in this book, Current Clinical Evidence in Ophthalmology. And also specifically for the advanced exam, they ask about medical professionalism and ethics. So there is a code of ethics published by the American Academy of Ophthalmology, and also ethical guidelines by the ICO. And for the low visual rehabilitation part of the advanced exam, you can review the American Optometric Association manual for the low visual rehabilitation. It showed to be very effective for the study of this part. Previously, in the previous years, I was recommending these books as a start for studying for the clinical MCQ questions. Like, these are the beginning books for anyone who wants to start with the clinical MCQ. These are the books that I studied when I set for my clinical ICO, like more than 7 years ago. So provision was the early one or the first one for the beginner. Review questions in ophthalmology by Kenneth. Will be the second one for the intermediate level. Review manual of ophthalmology by Massachusetts. By this is the questions book, not the review book. This will be for the higher level. But actually, in the previous years, again, I can see that these books are not well recommended, or these books are not very effective in targeting the current exams. So what will be the trend now, or what are the best study sources for the clinical MCQs exam, or to practice clinical MCQs, will be all the series of the American Academy, like the American Academy One Network Questions, Ophthalmic News and Education. These are like about 200 questions in each chapter or each section. And American Academy of Ophthalmology self-assessment tests. Again, these are like about 200 questions in each section. And online questions here are very effective, like iDocs and off the questions. Questions are very effective in the current exams, especially for the advanced 180 and FRCOPHTH Part 2. And also there are annual series, they are usually published every 4 years by the American Academy. They are MCQs. So there are MCQs for 2012 and 2008 and others. And this book, which was only published the previous year, which is a MCQs for the FRCOPHTH Part 2, which will show higher level of difficulty suitable for the advanced exam and the FRCOPHTH Part 2. So these are a must for the advanced 180 and FRCOPHTH Part 2. But maybe you don't need them if you are doing just the clinical ICO or the clinical clinical part of the FRCS Glasgow, because their level of difficulty are lower than the advanced 180 and lower than the FRCOPHTH Part 2. If you still have time and want to even further practice higher level of difficulty clinical MCQs, then you have these two nice books. Get Through FRCOPHTH EMQs and EMQs and MCQs for the FRCOPHTH Part 2. Although they are EMQs and you are not presented with EMQs in the exam of the advanced or the FRCOPHTH, but the questions ideas themselves are very, very good and will be very effective for the exam. So I want just you to shift your mentality in the advanced 180 and the FRCOPHTH Part 2 to think about what will be the best source to study for, or what will be the best text that have all the questions that I might find in the advanced exam or the FRCOPHTH Part 2. There is nothing like this. There is no single resource on the earth that will be enough for an MCQ exam. But it is just you are collecting your experience or collecting your knowledge from different and multiple resources. And the suitable way for preparation is to select your best resources or to select your best MCQs books. And this is what I am telling you now. For the FRCS problem solving, the current trend when I took this exam is that this is an approach exam. So they are presented by different scenarios and you are asked about how to approach these scenarios. So the best case or the best resource for studying of the problem solving at that time was the Will's Eye Manual for the clinical ophthalmology questions. And for the emergency questions, you can just refer to the emergency section, sorry, not from Oxford Handbook of Ophthalmology, but from Oxford Handbook of Clinical Medicine. So this will be the reference for clinical medicine or medical emergencies. Or you can refer to these notes by my dear friend, Dr. Walid Badr, which are very nicely collected internal and emergency medicine notes. However, if you are just doing this nowadays with the change of the wills of the problem-solving exams, so we just didn't say how did it change. The problem-solving was presented like a scenario, and you are asked to give your approach. How would you deal with this patient? So there were no short questions about this exam. However, in the last few years, the type of this exam changed from just a scenario to give your approach into short questions. So they still give you a scenario, but ask you short questions about the scenario. Asking about what is maybe the genetical type of retinitis pigmentosa, what is the investigation that you ask for this patient, how will you treat, and other questions. So studying an approach alone, studying the approach in the wells alone will not be enough. So you need more to be oriented with how to approach a case, a clinical scenario. So and what are the different questions that can be asked in every clinical scenario? What are the clinical questions that can be asked in optic neuritis scenario? What are the questions that can be asked in orbital cellulitis scenario and others? So when I thought about it, I figured out that the problem solving, as its name, it is a problem solving. So you have to solve a clinical problem. You can solve a clinical problem by two ways. If you have a good clinical experience, so you encountered this clinical problem at your practice, or you simulate that you have this clinical experience. So how can you simulate that you have this clinical experience? By doing as much as possible of case study books. If you studied as much as possible of cases in ophthalmology, cases with the clinical scenario and different questions, and with the answers of these questions, you are building your problem solving skills. So you are becoming more ready and more available, or sorry, more ready to solve this kind of questions. So what are these books? We have the Ophthalmology Review, a case study approach, and case reviews in ophthalmology, and these notes by Dr. Ahmed Mustafa Mosleh. These are called the Daily Eye Story, which he collected the clinical scenarios from the Ophthalmology Review and iRounds.org. So if you don't have access to these notes, just open iRounds.org and just read and study the cases and the scenarios present at this website. If you do this, you are most probably, you will have good clinical exposure to multiple clinical scenarios, and you are most probably will be able to do very well in the exam. For the FRCOPHTH, the refraction certificate, then I think this is the only single book that I studied during my refraction exam for the FRCS Edinburgh, and it is also the very good book for the FRCOPHTH London, and it explains the refraction process in details from starting from the history till the writing the prescription of the patient. The final exam will be the Viva and the OSCE. So the part 3 FRCS Glasgow, part 3 FRCS Edinburgh, part 2 FRC of London. What will be the best to study beside your clinical experience? I am here not asking or not talking about your clinical skills or clinical experience. I'm talking about the study resources that should supplement your clinical experience, but not doesn't substitute your clinical experience. Okay, they just make the framework that you are putting your clinical experience in. The first is the Ophthalmology Examination Review by Wong. Make sure that it is the 3rd edition because it has many great additions and the modifications and the addition of the new studies and the trials. This will be very effective for oral exam or the Viva exam. For the OSCE exam, check for the examination techniques by Showa again, which is who is the author of the FRCOPHTH website, and the FRCS Ophthalmology by Kikwook. These two books explain the examination techniques, and while the FRCS the examination techniques by Showa explain or focus more on the examination techniques or clinical examination skills, while FRCS Ophthalmology focus more on the review questions or the follow-up questions after you do any clinical examination technique, or also can be very useful for the Viva station. There are specific books that can be needed for specific exams. For example, the basic techniques of ophthalmic surgery can be are important for the FRCS Part 3, because there is a surgery station that you are asked about techniques of surgery. You are unlikely to be asked about details of surgery in the FRCS Glasgow, although there is the surgery part in the FRCS Glasgow is not much demanding. You are asked about the cataract, you are asked about the common surgeries. Please note that the DCR is one of the important surgeries in the FRCS. And while in the FRCS Edinburgh, you may be asked at higher level of surgeries. So anyway, you can review this book for both exams, FRCS Glasgow, Edinburgh, and also FRCOPHTH London. The professional skills and behavior, this book or this chapter, it is present in the Oxford Clinical Ophthalmology Sciences book. And if you just, I can show you the book. Let me show you. Don't worry, we are already we almost. I will finish the lecture. I know that you are tired, but those candidates who took courses with me, they know that my lectures are lengthy. Okay, so here is the book, Training in Ophthalmology, Essential Clinical Curriculum. You will find a chapter in this book which is talking about the professional skills, good medical practice and the communication, and the consenting and the legal responsibilities, and the breaking bad news. These are essential skills for the FRCS Edinburgh Part 3 in the surgical outcome and the research station, and also important for the FRCOPHTH Part 2, but it is not, of course, it is not enough for the FRCOPHTH Part 2. There is also the MRCOPHTH website, or the SHOW website can give you clues about what is ophthalmic audit and what are the ophthalmic research. And these are questions that can be also asked in Part 2 or Part 3 Edinburgh and the Part 2 FRCOPHTH London, but again, it is not enough for the FRCOPHTH Part 2 in London. So these are all information about the exams. Let me now tell you how can we help you.